Okay, welcome back. This is the last panel, so we're going to take you home, okay? We're going to take you home. And it's going to come full circle. We started with the population, the aging population, demographics, gender pay gap, care work, and here we are, the aging panel. Not quite that, not quite that. So I'm going to invite the panelists to each maybe speak 5 minutes. And if you have something more to say, then I'll allow you to continue. But I do have a special gadget here. And this gadget is called the bell. At 5 minutes, I'm going to go ding, ding, just to let you know your 5 minutes. And then we'll add on another 2. And if you are, if the speaker doesn't says, okay, I'm done, so we'll just continue. And then after that, we'll just open it to the floor. So I'm not going to ask questions. You are going to ask the questions. How about that? Right? Yes, we're going to do this. So now, let me first introduce Katni. I'm a huge fan. So it's really so she is someone that inspires me a lot, and really to do better every time I see Kani, really. And I'd like to invite you to say something that's really on your heart. Yes. Would you like to use the lighter?
There was no problem with the mic. I was demonstrating a few sad facts about older. No, dear friends, there was no problem with the mic. I was demonstrating a few sad facts about older women. They speak, but they are not heard. They are present, but are not noticed. In effect, they often become invisible. I am 82. This is because of the confluence of ageism and sexism, and sometimes racism. Talking about these 3 entities, anyone in the room who is a sexist, please put your hands up. No? Okay, good. Anyone who is a racist, hands up? Also no. Excellent. But the odds are high that you are an ageist. Ageism is everywhere, in our institutions, in the media, in national and corporate policies, and in our relationships, and in ourselves. According to WHO, 1 of 2 people in the world has ageist attitudes. So what is ageism? Ageism is more than just a bias. It is a deeply ingrained prejudice that sees older people, especially older women, as less capable, less relevant, and less worthy of consideration and respect. It manifests in countless ways. In the workplace, where older women struggle to find employment that matches their qualifications. In healthcare, where their concerns are too often dismissed. And in the social sphere, where they are often rendered invisible. One of the most serious consequences of ageism is that we are continuously bombarded with negative images, stories, and messages about older people. So our brains get wired to believe that getting old means going downhill physically, mentally, and cognitively. These beliefs become self-relevant and self-fulfilling prophecies. The older person who imbibes these negative self-perceptions of aging then thinks it's not worthwhile to age actively, not worth doing routine health screening, and nothing can be done about disease and frailty as they are part and parcel of getting old. As we develop policies and programs to improve older people's well-being via beneficial efforts like healthier SG, active aging centers, and age-friendly housing, our strategy must prioritize combating negative beliefs about aging if we want our plans to succeed. On the other hand, positive self-perceptions of aging trump other social determinants of health like socio-economic status. One remarkable research finding shows that positive age beliefs can act as a protective factor against dementia. In Singapore, 1 in 11 people over the age of 60 and 1 in 2 people over the age of 85 suffer from dementia, and it is more common in women. These are scary statistics, but they can be reduced by combating negative beliefs about aging. Is that not remarkable? No medicines required? In the workplace, ageism results in negative effects for older people. A survey conducted by the PAP Senior Group and NTUC showed that for workers aged over 50, their biggest challenge was age discrimination. Unfortunately, we have no gender breakdown of the statistics. When there are many older people facing age discrimination at the workplace, we know what happens to retirement adequacy, especially for women who often work part-time or on and off because of caregiving responsibilities. For some women, ageism is worse than the aging process itself. In our culture and elsewhere, youth and beauty are greatly prized, especially for women. Women become older earlier and are more often judged by their physical appearance rather than their accomplishments. No George Clooney effect for women. Ageism can change us in many ways. It can alter our perceptions of ourselves and negatively impact our health, longevity, and well-being. It can create generational divides, thereby limiting the benefits of interaction between these groups. Ageism diminishes us all. Ageism can also foster serious economic consequences. It has been estimated that age discrimination and negative self-perceptions of aging lead to billions of dollars in excess spending in the US. It is time that we calculated this figure for Singapore and take action against ageism instead of wringing our hands about how the aging population is pushing up health and social care expenditure. And if we did that, maybe we would not even have to raise our GST. Thank you.
Thank you, Connie. Thank you. Would you like to sit down? Would you like to?
I'll just speak from here.
You'll just speak from here.
Yeah.
So Marianne is also very passionate about this topic, and we actually do believe that a man is not a financial plan. So she's going to talk a little bit more about this, so
Right. Yeah.
take it away, Marianne.
Thank you for having me, because actually the issue, some of you know that I've been working in the field of aging longevity for the last 30 plus years. And I'm grateful for my grandmother who asked me to come back from New York to do this foundation. And she said to me that when she first started thinking about this foundation, she wanted to be for older women, a foundation for older women, because she said women had the most raw deal when they grow older. They worked a whole life, they worked very hard, care for everyone, taken for granted, and became invisible. As a matter of fact, Connie Kwan stole my thunder about it. It's so well illustrated that older women are unseen and unheard. So I'm so grateful to be here. I think that many things are being said today, this morning, that I really don't want to really repeat, but there's a couple of points that you want to highlight, is that as much as we construct women over the life course, older women actually kind of experience accumulation of all the ups and downs throughout the life, and they've experienced it all at the end of life when they're actually at risk for multiple vulnerabilities. As already mentioned, women live much longer. They have about 10 years of disability at this moment, according to this Duke NUS study. And they often, of course, if they're single, of course, have no family, or if they've been married, most likely to be widowed and then by then living alone. And then on top of that, we have talked at great length about how women don't have the same opportunities to earn money because of their caregiving. Or in Singapore, it's a very unique property of women not being able to find employment once they try to come back to work. If you look at internationally, women's labor force participation have two curves. They go to work when they're younger, they drop off because they have care responsibility. They have another peak of going back to work. The second peak in later life may be a little bit lower, but there is an M-shaped curve. Singapore's curve goes like this. Okay, they'll go to work, they drop out, and they're never really able to get back into the workforce. Lately, there's been a small improvement, a tiny bump. But definitely, we need to make it much better, much easier for women to access paid work or income in some way. So therefore, as they grow into later life, they're vulnerable, at risk of multiple vulnerabilities. One, of course, financial, because they haven't been able to make enough. And in Singapore context, even if you look at CPF for men and women, generally speaking, most men don't even have that much money. So by the time they pass away, there may not be much money left for the wife if the wife has not been working. And as you mentioned before, we used to go around telling women that your man is not a financial plan. You need to at least know what you need to grow older and make plans towards it. Whether it's working, whether it's asking your children, don't give me a party when my birthday, give me cash. That's also cool. My grandmother used to do that. As a matter of fact, a side story is that my grandmother was able to have some money to start a foundation for a woman who had primary 3 education. Never really worked, because I remember she would tell my father, her children, I don't need a party. Don't give me anything. Give me shares. Okay? Yeah, and I couldn't call it at 10 o'clock or 4 o'clock because she listened to the stock market report. She learned. Okay, and that's really remarkable. She understood that she must have money, and money of her own. And that's very important, even from an empowerment point of view, not to speak of the fact that you need money to live on as you grow older. But that side story aside is that other than the financial vulnerability, is also they're socially vulnerable, because if they live alone, then of course the chances that also psychologically vulnerable because of being socially isolated. And we know Singapore has a significant social isolation issue for our older adults. But some years back, there was a small study done by us, but also a national study that showed that about 50% of all older people over 65 are socially isolated. And it has nothing to do with disability. And majority of them actually live with families. And we all know that social isolation leads to a higher incidence of mental health problems, physical health problems, and don't live as long. So social isolation is a significant issue that women, men and women, but certainly women are at risk for a longer period of time. So I think the issue about older women being invisible and unheard is really true, because no one pays attention. Whenever, in the beginning, we tried to mainstream older women's issue into mainstream, but no one wanted to hear about that. Okay, and we're trying to mainstream within women's organization, not SCWO for sure. But on the other hand, women's agencies are not interested in older women. They'll say, we're not about older women, like, oof, like that. So, it's very, very frustrated about that there are no men's land, no one wants to own them. Recently, I had a conversation with a very wonderful woman professor who's starting the Center on Health on Women in Asia. So I said, oh, that's great, what are you doing about older women? And she goes, oh yeah, we should do something about menopause. So I said, after the 50, the second half of your life is not on people's mind. Of course, she's gets it right away that, well, we need to think about beyond menopause. But the automatic response is that it only goes to be when women with a natality, and once stop having babies, and somehow people are not interested. And I just want to make a point of that, because I'm really sick of this natality as a central discussion about women. You go to UN meetings, WHO meetings, any kind of women, any kind of meeting, when they talk about population aging, that's what we do, is they always talk about women are not having babies, as if, women's responsible for everything, for population being smaller, for economic, labor process issues, because women are not having babies. So this is a side comment, but I just want to say that because it's a little bit distressing to me that becomes such a central issue when it's just only one of the issues. It's also not just a woman's decision as to how many children they have. Right? So men have nothing to do with that in the family. So I just want to say that we want to stay outcome, not that we don't want to address that, but not to make it such a central issue about population aging and the implications on labor force and all that, and economy and all that. But in the end of the day, my point is actually I think older women deserves more attention to the situation as they grow older. And we are really not looking at enough, both from policy and practice point of view. Thanks.
Okay, thank you, Marianne. Actually, when people talk about aging, they always talk about the silver tsunami. And tsunami brings destruction. But really, we should think of the silver economy as a silver reservoir, a reservoir where we can tap on skills, experiences, because they really bring different skill sets to the table, right? People who are older. So now we're going to talk about tomorrow's new old, and that's me. No. And Teck Cheng's going to talk a little bit more about that. Teck Cheng?
Yep. So let me also introduce myself, Teck Cheng. Besides being the president for Society of Wings, which is a charity that empowers women to age successfully, I also sit on the SCWO board, co-chair the Task Force for Aging. It used to be called the Aging Task Force. We did a rebranding and called it the Task Force for Aging. So one of the things that we realize is older women is not a homogeneous group. We are all individuals in our own right. And one of the things that we want to focus on is also the younger cohort of older women and what we call the tomorrow's new old. These are the group of ladies who will turn 60 to 70 in the year 2030. And this group, I guess, is a more privileged group than the earlier generations. They grew up with Singapore. They have better access to education, better access to jobs. And we believe their needs and aspirations are actually quite different from the older cohort. And actually, the survey findings does corroborate that hypothesis. So one of the findings is that actually this group of older people would like to stay in the workforce for longer. The aha for me is that they are not necessarily staying because they want to earn more money for retirement. The key motivation and driver is actually to be physically and cognitively active and be socially connected. Now, this is really powerful because, as Kani has alluded to, there are also other research that suggest and provide evidence that older people who stay in the workforce actually have better health outcome than their counterparts. And this is really powerful, right? I mean, it's win, 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 win. It's win for the individual. They want to stay employed, stay in the workforce, get the benefit of staying socially active. It's win for organization who in Singapore is facing a labor crunch. It's a win for the economy. I'm an economist by training, but I promise I won't crack any more economist joke because we have quite a few this morning. But it's a win for the economy because that's where we can talk about sustainable growth. It's a win for society because it actually reduces the long-term healthcare cost burden that we have heard today. So it's such a powerful win, 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 win. But what is it that we need to do to unlock this power? One of the findings of this research is that this group of people have suggested and said very explicitly that they are looking for flexible work arrangements. Because I guess this is the stage of their life where there are competing demands, whether caregiving for older parents or younger children or teenagers. They are also going through their own life transition, menopause being one of them, or they may be having conversation about re-employment in their workplace, right? So they are looking for opportunity to do flexible work, whether it's flexible location, flexible time, flexible job, as in job sharing. And I thought that the Singapore tripartite guidelines on flexible work arrangement requests is a good step in the right direction, but we definitely can do more. How can we reduce the friction for older people to stay in the workforce or older people to rejoin the workforce? I was having this personal story, right? I used to play this board game called the Game of Life. I'm not sure how many of you have played it when you were a kid. Okay, thank you. I played that when I was a teenager. That was 40 years ago, right? Just earlier last month, I bought it. Apparently, it's still available in Toys R Us and all leading retailers. I bought it as a birthday present. I played it with my daughter and my nephews. Guess what? The life path in the two editions, the 40 years ago edition and the 2024 edition, is the same. It is grow up, get an education, get a job, retire, and then live your old age. Does it have to be so linear? I don't think so. We are living longer, healthier for longer. Surely there can be multiple pathways in our life. How do we make this pathway accessible? And how do we make this pathway porous so the individual can take a sabbatical break, whether to pursue higher education or second careers in another industry? How can they take a break to provide caregiving and then rejoin the workforce at any juncture in their life? I mean, that would be something I think we aspire for. And I hope that maybe in 30 years' time, when I will buy the same game of life for my grandchildren, hopefully there will be grandchildren, the pathways in that game will be very different from these two editions. There's also another finding in the research that shows that 7 in 10 of the older women actually expect and want some help. But where they want help in is not necessarily in financial. The key area where they are looking for help is actually in emotional and social well-being. And this is an area which I think has been overlooked, and I think Marianne has kind of alluded to it as well. How can we promote the well-being of this older woman in society? So,
do you want to stop here? Okay. We're going to move, thank you, Teck. We're going to move over to Peter. I think Peter may have a little bit more insights into emotional well-being because he's been doing a lot of groundwork as well, and also with grassroots organizations. So maybe you can provide more insights.
Right. Thank you, Junie. Good evening, everyone. I'm Peter. I'm with SingHealth and Singapore General Hospital, and part of my work involves working with the ground, the grassroots, the social organization, community partners, to see how we can build an ecosystem that is dynamic, robust, and to provide, the fertilized ground for our seniors, for our population to age well, live well. 10 years ago, this Harvard Medical School professor, Dr. William Hasseltine, came to Singapore wanting to write a book about Singapore healthcare system. I was tasked to be his runner, so to speak, bring him all over Singapore to meet with all the CEOs and all the politicians whom he can name to see how he can write his book about affordable excellence, the Singapore story. And I provide him with a lot of materials as background reading. And what took me by surprise was in one of his page 5 or 6 of his book, which I quote that he specifically cited, the respect and the education for women as well as their healthcare needs since the Women's Charter was enacted in 1961 to improve the rights and protections of women under the law is the cornerstone because it is deemed essential to the future and survival of Singapore. And because educated women are able to look after their healthcare needs during their pregnancy, their babies, and their families. And fast forward, according to the statistics, Singapore women life expectancy stands at 85.2. And guess what? Men is barely 80.7. So we all know that women outlive men. But the problem that we also face is that the productive life years or the healthy life years of whether men or women is a miserable 5 to 10 years. In other words, you can live longer, but you are actually not living better. So what we need to do is really to narrow the gap between the life expectancy of the life lived and the healthy life expectancy, meaning what is a good life to the individuals. Because we look at the research from the US, and indeed they found that for our population of seniors, especially men or women, if they have limited social network and support, they live a shorter lives and they live fewer lives of good health. And the government can only do so much, to try to direct intervention. But a lot has to come from the society, from the ground, the community partners, associations and organizations to see how we can tackle this challenge together. And because it affects every one of us, whether we have an elderly family member or next of kin or the loved ones, to make sure that we can all walk this journey together. In fact, as part of my work, which I walk the ground a fair bit, over at my catchment of where I'm in charge, 304,000 population in the South region, a good 28.5% of my population are above 60. And in 2 years' time, 2026, we're going to be super aged across the entire South region. And 10% of the residents under my area are living alone. That accounts for about almost 28,000. And it's a scary number because how am I going to work with the community to reach out to these seniors who are living alone, who will feel depressed, who don't have the social networks to step out of their community, their household unit. I was once at the ground at Dakota Crescent, and was with my nurse walking the neighborhood, and we come across this elderly lady. And my nurse was telling me that this elderly lady has been out at the void deck every day, and he struggled to get her to talk why she wants to live and stay at the void deck every day, because she has a home. So through an hour's conversation, she finally shared with us that she's afraid of dying alone at home, and that's why she stayed out the whole day. It's very sad, to hear that, she has a household, she has a house, and she's afraid of staying in a house, and she stays out because she's afraid of dying at home. So we try to then talk to her and get befrienders. And of course, some of them are just uncomfortable to just befriend someone because, again, the sad statistics is that I got it from my friends at SPF. Singaporeans, despite us being a very educated society, a very developed country, get scammed every other time. I've got some numbers which really befounded me, that we have about 50,000 over records of scam in 2023 versus 33,000 in 2022. And the amount of money that has been scammed amount to $650 million. I didn't know that Singaporeans are so rich to be scammed, but something has to be done to avoid this, things from getting worse. So what we try to do over at my area at the South Precinct, we came up with this program where we then work with the polytechnics and the junior colleges to get the youths who express an interest to work with seniors, who express an interest to work and partner with us, where it is not just a once-off volunteering effort. We ask for their commitment, we train them to understand the psychology, to understand the emotional needs, to understand what it means to befriend a senior. And we have their commitment that it must be a 1-year attempt with us, that they will befriend a senior to conduct a survey, understand their needs, social, psychological needs. They will knock on their doors, 6 weeks, 3 months, 6 months, and 1 year, to journey with them when they need to seek medical help, to journey with them when they need to make friends or take part in activities. And we found through our evaluation that we have averted 50% of the seniors having to seek emergency care just because of psychosomatic symptoms. So I think it is really the human touch that sometimes we over-medicalize the issue, with our seniors, and we just need to bring ourselves to see at the eye level what matters to them. So we ask the questions to the senior, what matters to you, rather than what is the matter with you. So this change of conversation, this change of nomenclature, what matters to you to live a good life, what matters to you to live a meaningful life, create the dynamics and the trust between us and our seniors whom we are serving. What I suppose this is not all, because as much as we have been putting a lot of effort with the government's movement on Healthy SG, we need to do the part on preventive health. So we are actually moving forward to look at the working adults of the 30s and 40s and we have heard from this morning's session, talking about mental resilience, talking about the stress of our fast-paced moving society. And pretty much we can blame it on social media, which is fairly true, but it's about how to step away, from this influence and from this global attention on us when we take our eyes and our hands off our devices for barely 5 minutes. So in fact, it was very interesting when we did the volunteer training with our students from the polytechnics and junior colleges. We told them the first thing is, during the course of the training, put your handphone not away, but at the front of the room. And the boys and the girls was like, no, I can't, I need to be on the TikTok and the Instagram any other moments. I said, no, this is a condition. You must put your handphones away. And it was very difficult because you can see that they were very nervous, they were very edgy, they just couldn't sit still. But I think once we reached that inertia, they felt that, hey, it's actually all right, not to be so addicted to my phone, to be watched, to be checking on what's going on. And then we tell them that when you talk to our seniors, when you talk to our seniors during the interview, what they expect of you is the respect. Because it is important to look at them in the eyes, because you're asking them what matters to you. And we hope that we can do more with our partners. I was very glad to network with Tim and a few other colleagues from the organization, the previous organization, and we hope that what we can do in SingHealth can reverberate to the rest of the country.
Thank you, Peter. Thank you very much. Would any of the panelists like to ask each other questions? Because I saw like a question coming up from Kani.
Well, one question I would like to ask, and it's about social isolation and loneliness. Because we keep on thinking that it is the women and the men who live alone who are the most socially isolated and lonely. But again, Duke NUS did an interesting study, and they found that older women who live with families are actually more lonely than older women who live alone. Because older women who live alone begin to form their own support groups, while the ones who live in families are actually isolated. The grandchildren just come in and say, "Hi, Grandma," and go to their rooms. So living alone and social isolation is not synonymous.
Yeah, I agree. Actually, I mentioned that the vast majority of them actually the people live in families, so I don't want to put that up. However, I think for women are at risk because they live alone, they have more disability, like arthritis and all that, and mobility issues. With time, they're still at risk for being more social isolated. So, social isolation is a very specific term. It is based on a certain kind of validated scale. They ask questions about, do you have people to call when you need someone? Do you feel lonely? How many people see you every week? That sort of thing. So it's a very specific kind of a definition. I'm absolutely right. By living alone doesn't mean that we are social isolated, but being social isolated risk is higher in some people as they grow older when they live alone. And I do actually want to ask a question about future generations, because I think older people are very heterogeneous. So 65, 75, 85, 95, I think the future generation will definitely live to 100. And so some of them will be 100 and be very vital, and some people will be 65 and not be very vital. So therefore, I think the issues of risks, I don't want to make a huge deal about it because we can plan for a better future, but there are still those risks. Because no matter what, I think we're still not at a phase where we can totally stop people from physically deteriorating as we grow older. And I think women definitely have higher risk for mobility issues because of high risk of arthritis and things like that. So I do think that we have to think further afield, even for the future generation who would have more money because have been working more or might have, have better health for longer. I don't think we can assume that all, particularly for the old. So I just want to sort of add that caveat.
Thank you, Marianne.
I think what we were trying to do over at the south side of the system, SGH, is to bring our specialists out to the community to improve the health literacy of our seniors in the community. So we have been scheduling our specialists, across all the disciplines to go to different pockets of the region, the precincts, over at the community clubs, over at the active aging centers, over at whatever avenues there are people who are prepared to host us, to get our specialists to talk about health issues. We rather that they come to the right source of truth and to get the appropriate information than what they can see and told from the social media, which they may concoct their own treatment, their own self-care, which lead to possible greater harm. Aside to today's forum where we are talking about gender equality, in fact, my biggest challenge is to reach out to men. For some reason, men above a certain age group are extremely egoistic. They will never admit that they are ill. They will never admit that they are not well, or they are coming down with their symptoms and illness. And by the time they landed on our ED, it is like almost going to resuscitate them, back to health. And that is true across my precinct of 304,000 residents, right, for the men. So interestingly, what we did a pilot over at Tiong Bahru was we worked with the grassroots to organize a men's-only activity on a Tuesday morning from 9 to 11. And it's strictly just for men, because they rather spend hours sitting at a coffee shop drinking beer and coffee and not socialize with women. So we force them to come, we register them, give them some freebies and whatever, only for the men. And of course, we bring in a specialist to talk. And of course, we design the talk such that it's about men's health. We have the first urologist to talk about prostate issues. We have the second specialist to talk about pain. Another specialist to talk about hearing issue. And of course, lining up next month, we're going to be getting an andrologist to talk about men's sexual health. Closed door. And lo and behold, when we ask 3 simple questions, have you learned something today, new? Have you learned something that you have not heard of? And what else would you like to learn? We get more than 50% of the participants saying that they thought that they knew, but it was all wrong information. Which is, attests to our hypothesis that they are picking wrong information from whoever they know. And of course, then the scary part is that they want to know more about chronic diseases, how to manage diabetes, hypertension, hyperlipidemia. It's like, don't you read the newspaper? Don't you watch television? There's so many information out there, but they are oblivious to all these things. So the issue that we tackle with men is a totally different realm, because when we did something similar for the ladies, we get a different result. They are quite informed, but I think they can do better, because they do take charge. They're agents of change. They take charge of their own health. They know how to seek help, or they'll ask their friends. So we need different strategies. We need different tactics. We need different approaches, to work with the different cohort. So much so that in one of the sessions last month, we found that a few of the men brought their wives along. And it's like, my husband has been telling me every Tuesday he comes here, and I should come. I say, why? Because he needs to be reminded. I say, good, that's good. And because it has attracted so much attention, because it was really sponsored by Minister Indrani, that we're going to bring this down to Chinatown area, similarly adapted it for the men only. And I think at the end of the day, I think we need to harness the power of the social networks, whether it's for men or for women, but we need to customize, and we need to see who we can leverage on the works. And we can't possibly do it alone. We just have to reach out there to see whom we can partner with. One of the things we hope to do is to leverage on the research, by the academics, by the academia, to see how we can translate the ideas into action, translational action. And I think that will really make an impact and inform change, to our system.
Okay, I know Marianne wants to say something.
No, actually, I just want to echo Peter's point about socialization. Most of you might have heard about this study was done in Harvard some years back. It started in 1938. That 400 young men from Harvard, very privileged, and 400 young men from south side of Boston, whereby they're very poor. And so this group of researchers, actually 3 generations of research, have been following these people since 1938. And they have different kind of results. They showed, cholesterol, this and that. But the most interesting study from a few years back was that the most important determinant to see if someone can live longer, live happier and healthier is when they're 50s, have very strong social network. So I think the whole thing about social network is extraordinarily important. And I think Peter's point about men, we also find them more difficult to engage. Women are more naturally sort of sticky. However, we also found that they don't, when they've been living at home for a long time and family been taking care of people, whatever, they do need a little bit of catalyst. When we first started working in this area in Whampoa, where we did that study that found that half of the people over 65 were socially isolated, we started a little cafe. Because when we asked people, men and women, why don't they come out? The answer was there was nowhere to go. There was nowhere to go for them to naturally connect with other people to make friends. So that little cafe was very useful. It's just like just drop in, not a lot of time commitment, just a cup of coffee, it's free. And the women used to come and cry about how lonely they are. But of course, once they kept coming together and start doing things, they are quite sticky. They start doing things for themselves, create all kinds of programs for themselves. But they do, I don't think that's naturally automatic. I think as community developers, like Peter, you need to, as a community, or just as neighbors or a citizen or resident community, have to reach out because it's not so easy for them to naturally make friends right away. So I think just want to say that catalyst is important, what Peter's doing, and the little cafe and things like that is important.
Thank you, Marian. Teck Cheng, you
I
wanted
mean,
to
if
say
I could
something?
add from the Wings experience, we do see that creating that space for older women to come together, to form that connection, it really builds the emotional resilience. And you see them supporting each other during their own personal crisis, may it be a loss of spouse or whatever the personal situation may be. And many of them actually spin off, right, to form their own self-organized groups. They go for walks, they go for coffee on their own. And I think this is where it's very powerful. The multiplier effect is really, really powerful. I just want to also add that there are some quarters or some school of thoughts that, we need to empower our older people with technology. Technology can solve many, many, many things, right? Yes, technology is great. Definitely is a mode to build connections for the older people with their children or friends and families, especially if they are not so mobile and, if they can do a video call, it's a great form of communication. But I just want to emphasize that it cannot be the only form of social connection. We are all humans and we all crave face-to-face physical interaction. So I just want to put that on the table and caution for us to be calibrated in the use of technology.
Thank you, Teck Cheng. I'm going to now open the floor. Any questions? Oh, yes. Would you like to introduce yourself, please? And then could you end with a question?
Okay.
Like a question mark?
Hi. Okay, my name is Samsia. Okay, I'm a business owner. I'm proud to say that my oldest worker is 80 years old. She is a butcher. Okay. And I do have 76 years old. And so we do create a corner. Okay, we call it Senior Citizen Corner. And their KPI is OTOT, on time, on target. Okay? So that's what we have done for them because they have been with me for almost 25 years. So, yeah. So I think when we talk about the older people, it's good for them to have a purpose. Wouldn't you say that, that could be a consideration so that they know that, there's something that I can do, that I can contribute, although I'm old. Yeah, so that's my question actually on the purpose.
Okay, thank you. Maybe Fanny, would you
The
like-
purpose, is that?
Yeah, so I think a lot of us, I think the organizations, and thank you so much for hiring older women, because now it's getting difficult where companies don't want to hire older women, and they are trying to say, oh, okay, you can be the coffee auntie, right? But not everybody wants to be a coffee auntie because we are all professionals. So there will be a cohort, tomorrow's new old, who would be facing that predicament because they are professionals. They can contribute much more than serving breakfast at childcare centers, for example. So there's this purpose. How are we going to tap on these older women who can continue to contribute?
Well, I think, first of all of us, whether we are young or old, we need a purpose in life. It's not just the older people. And of course, sometimes when you're young, your purpose is maybe to earn more money so you can have better financial, or support your children. But for older people, in fact, if the retirement adequacy is there, then they are more of they want to give more to the next generation. It's not so much for themselves that the purpose is, but it is for leaving a legacy. So we have to let older people decide what kind of a purposeful life they want to lead. And we can't predict it for them and design it for them, but we have to give them the opportunities to be able to do that.
Yes.
Yeah, I just want to echo that. I think this is an interesting phenomenon in gerontology called gerotranscendence. The notion that as we grow older, we've been there, we've done that. The interest has become increasingly less about yourself, but we can do for others. So I think that generally speaking, a purpose is important for everyone, young and old, men and women, as Connie said, but not any less for women to want to do that. And sometimes I think people think that if you're older, you may be more frail, then you can't do anything. And I've seen over and over again how that's just absolutely not true. They just have to give the opportunity. There was an older lady in one of our day centers who was in her 90s. And so I think she speaks a dialect that not many people speak, like Teck or something. And so, so she seems very quiet. But then we have some young women that were volunteering and stuff like that. And it turned out that she was a wonderful agony aunt. Should be very patient and listen to all their woes or the boyfriend problems or whatever they're doing. And it was somehow, even though it doesn't speak the commonly spoken dialect, she's able to sit there, hold their hand, listen to them. And I'm thinking, what a wonderful contribution to be sitting there and giving somehow emotional counsel support. So it really sort of helped me understand better that there's space for absolutely everyone to contribute, no matter how old you are, how frail you are, whatever it might be. And certainly oftentimes women think that, they're not, they have no space to contribute, but it's not true. I still remember we were running this financial literacy program for low-income, middle-aged women. And so we have these graduations for them. As a matter of fact, my colleague ran the programs here. And so sometimes there'd be 100 or 200 of them in a group, and the minister will be there, whatever, they're graduating. And there was this lady that came up, and she was speaking Mandarin. And she said, before this course, I was nothing. It was sort of really starting to hear that. She said, I was nothing. I was just an uneducated housewife. That's how she thought of herself. And then she said, now I can stand in front and make my daughter proud that I'm my own person. So I think it's not just a financial literacy thing, it's a sisterhood, it's about being empowered. So I think sometimes it's very hard for a lot of, at least current generation women, to feel that in a society like Singapore, if not highly educated, not making a lot of money, that they are somebody worthy of themselves. And sometimes very hard for them to feel that there's space for them to contribute. So I think that's something that I think all of us could do better, and make sure that women don't feel that way,
And this is where ageism comes in, because we are so attuned to the fact that older people have gone down cognitively, physically, mentally, and it's a downhill journey. And that is why having that positive perceptions of aging, it's not the age that matters, the capability, whatever it is. So to my mind, ageism is one of the most obstructive elements that stands between old age that stands from aging successfully. And we don't pay enough attention to it. We talk of filial piety, and in a way, sometimes filial piety, we can be overprotective towards older people. Or say, stay at home, don't go out, you may fall down. So older people need autonomy. They need to make their decisions. Of course, there is a risk that if you go out, you may fall down. But you have to give them autonomy. So this ageism is what makes us, we believe in tough love for young people. We should have tough love for older people. Let them do things themselves. So a lot of my patients, when I was practicing, wouldn't let their older father or mother walk. No, you will fall down. I will come with you. So this is all stems from ageism, because we have a preconceived idea of what an older person is capable of doing.
I'm sorry. want to echo that. I think when we don't understand the different generational perspective, for families, all they want to make sure is that older mother or father, they're safe.
Yes.
Okay? So don't go out, don't do this, don't eat this, don't do that because it may not be safe. And the subtext is that it's more problem for me. Okay? We felt it's more problem for me. So after all, I'm thinking there's a bit of a subtext to that as well. But older person, not any different than anybody else. They want to lead a life. They want to be able to make their own decisions, go do whatever they do. And they say, I've been taking risks my whole life, so I know how to take risks. If I fall, I fall. So I definitely want to echo that. But I also want to say that older women have double whammy of ageism and sexism, because also how we socialize women. What I was saying before, if I'm just a housewife, I'm nothing. So of course, future generation will feel less of that. But also, I don't know, sometimes I'm thinking, how am I raising my daughter and my son, so that we remove this kind of social construct and obstruct how women think of themselves. I'm lucky I went to women's school all my life practically, so I don't really have that sense so much, but I do really still see that even amongst the younger people today.
Yeah, I think families play a big part in that, and mothers especially, right? Why do you let your daughters wash the dishes and you don't let your son wash the dishes? Why? Right? Yeah, it starts at home. The instilling that the whole gender equality, everybody has a part to play in household chores. Yeah, it's not only the son who gets away with just running away after football or something, and then the girl has to clean up.
Yeah, I just want to talk a bit more about the purpose. Purpose is important to everybody, young, old, man, woman. And I think as a society, perhaps, we may not have taken a lot of reflections about what your purpose is. And I asked the same question at work to my younger staff members, so what is your purpose? And they cannot articulate it. In Wings, when we run a workshop with older women, so what is your purpose? They can't articulate it. So I think we need to spend some time, maybe that's my homework to do as well tonight, to think about what your purpose is. Very often when we ask this to older women, they say, oh, I have a grandchild, my daughter just gave birth, and I want to take care of the grandchild. But is that really a purpose? I don't think so, right? The purpose could be I want to care for my loved one or those people who matter to me, but taking care of the grandchild is an activity, it is not the purpose. So I think we need to take a step back and ask ourselves what purpose is for us, and then we can figure out the how and what to do.
Any, Peter, you want to say anything? Or
Yeah,
I shall throw
interestingly
it out.
that Dr.
I see a
mentioned
question coming from a little girl. Oh, okay. Hey.
I'm just so impressed with this panel out of the entire morning, which was wonderful. We can't hear you. I'm just so impressed and touched with the vulnerability of the sharings on this panel. And I really can't thank you enough, because I have an aging mother who's 82. She lives in India on her own. She's a retired army officer's wife. She was diagnosed with malignancy last year. She chooses to live on her own. She's on the second floor. Neighbors around, of course, they tell her, you're very brave, you're very resilient. And they also tell her, oh, what if something happens? How will you manage? You have a chairlift only till the first floor. The second floor, you have to walk on your own. And her purpose is to pay back. So she'll either go to, we are omnists. Omnists, I just learned 2 months ago, are people who love all religions. So she will go to a church, she'll go to a temple, mosques, she's not allowed, so okay. But she'll just go and she'll serve there. So that's her purpose, to serve. And she says, I just want to stay healthy, however long I have to live, so that I can serve. And her cancer has not spread. That is as of 6 months ago. We don't know what will happen next month when the test is. But what I'm telling you is the stuff that you're sharing is so beautiful. And it's bringing tears to my eyes. Thank you.
Oh, thank you so much. Thank you. That was an exclamation mark. Yes. One of the youngest participants, I think, here. Who's 25?
25 in spirit, young energy.
Yes. Oh, you are the only 25.
Oh my God.
Oh, no, there is somebody else.
We have a few more.
Okay, the young ones are there.
Yeah, so Calissa.
21, is it? Oh, well done.
Wonderful. Welcome.
Wow.
Yeah, so I'm Calissa here. I'm here as a mentee of Ms Junie Foo.
Oh my.
And I think it's been a wonderful journey, right? Because when I first met Junie, I was also very involved in women's causes here in Singapore, and I was advocating for that as part of the first female leadership for a youth community that's affiliated to the World Economic Forum. And I think coming here today and looking at this panel, I really feel like every single person on the panel and every single person in this room has views and has touched on certain things that matter, right? So equal space for aged women, for women and men and everywhere. Equal voice, especially when it comes to ensuring that women of all ages have a voice. Equal worth. I think that's something that has been touched on very clearly in today's panel. And I would also like to share how heartening it is in Singapore to be in a room and a community where there's so many people who are all empowered, right? Not only empowered women who empower women, but men and male allies and people from all walks of life that want to empower women and other minorities in Singapore together with an intersectional lens. So my question is, what can we do as individuals, right? Beyond being corporates, beyond being youths or whatever, of all age and of all, I guess, creeds in Singapore and beyond, what can we do as individuals to be kind and to transform societal structures and our aging population, as well as, domestic structures and family and all of that? Because I think this room has a lot of people who can deploy capital, be it social, financial, or cultural, but it's also important to take a step back from what we are to what we can do. That's all.
Okay, thank you. Well, the future is bright. Connie, so...
Well, one thing we can do is to stop othering. Stop dividing people into groups. These Malays, these are older people, these are, cleaning women. If we stop othering, I think we are all human beings united in our humanity. That's what we should do.
Yes, thank you. Any views?
Well, I think it's important, as Connie said, to remember we're all just individuals. We play many roles, a daughter, a mother, or a boss, or a neighbor, or whatever it is. And so we have many potential to make a change in all those different roles. I think we just have to, as Connie said, be very sensitive to others. And in this instance, I'm talking older women. We just have to be able to see them, and we just think about where they're coming from and what we can do to acknowledge them, embrace them, to support them, make them space for them to contribute and participate, make them and also provide support in time they need to. I mean, it's oftentimes I go to lunches and restaurants on Sunday, you see all this family sitting there, everyone chit-chatting, and everyone's having a good time. You see this one little old lady or little old man, old ladies usually, sitting there maybe with a helper just eating by herself in this lonely bubble, and no one is talking to them, I assume it's a family. So sometimes they're just very taken for granted. So you're asking a much bigger question. I'm just going to limit to just about older women. I guess it can apply to everybody else. But I think particularly I want to put a plug in for older women because they are so much taken for granted. I mean, sometimes I'm guilty of the same myself. We're taking care. My parents lived with me. They were quite frail. I'm busy all day. I have 2 children with learning disabilities. So by the time I get to my parents, like 10 at night, they've been home alone all day, I mean, of course, not as they have no friends and all that, but even my mom was very sociable. With time, their friends die, their friends move away, and she's frail. She doesn't have the energy to go out and make friends. So the world, generally speaking, gets smaller. Not everyone's the same, but generally gets smaller. So, for her, it's like to wait for our grandkids to come home, for the daughter to come home and spend some time with her. And I actually feel like I can give her half an hour because I'm tired, some days I'm just too tired. I can't deal with it. So I just feel like we have to make a little extra effort as a family member or, as in the community, if I'm an employer, if I'm a neighbor, whatever. So I think that to recognize as an individual, we recognize other as individual and respond to them accordingly,
I'm going to also ask...
Big, even
sorry.
small is good.
I'm also going to ask an action item for an action item, so that when we next have stage, on the stage, we'll be able to do some kind of a report as to, what we have done over the year for our next SAGE event. So maybe, Peter, you can give an item that you think
perhaps
will be able
this
to
is
do.
more personal. And insofar as we all work, many of us work in organization, and there's organizational policies from HR, from corporate directives, what we must do to manage our workforce. But, if we are in the position of authority, we can exercise that judgment call to really understand and ask ourselves what matters to our staff and our colleagues in the department. So really, I think, we talk about the flexible working arrangement earlier today, and to really make that policy works, we as the business owner or the head of department or the founder of the organization, we can walk the talk and make a difference. If our colleagues were to come to us and say that I really have to take a day off from work, but I don't want to take my leave, but trust that I'm responsible and accountable, I will still get things done, would that be all right? I think if the trust and the respect is there, why not? And rather than to insist that the person must put on record that you must go on an MC or go on a leave. Because sometimes we will reap the return of the loyalty of this person, that I have a very supportive boss or supervisor or company, and it is not beholden by the policies and the rigidity of the bureaucracies. So that's what I will do at an individual level with my colleagues and my staff, and hopefully that can spread the word to my counterparts and my colleagues of the other departments, and together collectively we can shape and change how to make a more inclusive organization and society.
Okay. Thank you, Peter. Thank you. Cheng?
Yep. So I've talked about mental well-being as one of the top priorities for the younger cohort of older people. And I'm very glad that the Healthier SG program will be extended to mental well-being in due course, I think in the next 1 or 2 years. I think this is also a space where the whole ecosystem, right, whether the government, the civil organization, the employers can come together. And in fact, it's a space where I think the social sector can step forward and take the lead in this. So this is what I'm going to do. I'm going to delegate upwards to my SCWO president that let's SCWO champion the emotional and mental well-being for older women.
Okay. Marianne?
I just have just one comment. I just do think that when we talk about older women, we're thinking about the life course, right? All the things you need to do so they would be better at the end. So whether get better access to jobs, whatever. But people actually forgot to get to them at the end for the older women. So I just ask everyone to be more aware, whether a policymaker, employer, whatever, is that think about the older women today, and not just about how to move upstream. I'm thinking the upstream is important, of course, but just not to forget the endpoint. Not an endpoint, but you know what I mean, right? The older women today and what they may require and how they can contribute.
Okay, thank you.
I have a concrete suggestion. I don't want older people to be called seniors. What are seniors? Then who are the juniors? Then we have a senior minister. Then we have senior positions in employment, So I think older people should be called older people. It is more accurate, inclusive, and respectful. I mean, after teenagers, you become an adult, and then you continue being an adult until you die. At what point do you become a senior? And who decides that you are a senior? So I want us to be called older people, and come join. Only the lucky grow old, so please join the group of being lucky.
Thank you, thank you. So with this, I shall end this panel. Thank you all very much. Thank you. And if you are still single and going to get married, marry a guy 5 years younger.
Thanks for that bit of advice. Thank you, Dr. Soin, Dr. Tsao, Ms. Bay, Mr. Lee, and Ms. Foo.